Dr. Shivadev, what are the health challenges and remedies of women reproductive health in India?
There are quite a bit of challenges because the first is the stigma, the taboo, access to proper medical specialists in this area. Let me tell you, Smita, people are not really aware who to talk to. Who
Yes.
should we approach? Are there even doctors to discuss for the sexual aspects? So is it okay for me to go and talk, or does it make me a different person, or is it really going to be curable? Is it going to be treatable, or do I live with this? So again, these are some of the challenges which we face, and not everywhere access to medical information is available. So there are a lot of remote villages in India where primary healthcare setups need to have proper physicians. So I think the reforms of it, or the way to go about it, and the challenges can be many. It could be as in some remote parts, I mean, nutrition can also be a problem, right? So not having the right nutrition does not give to a good hormonal system, and then that can affect their sexual and reproductive health. Anemias and having low hemoglobin can make them weak, can make them tired, can have consequences on sexual and reproduction health. So there are all these gamut of things which can have access to information as well, access to medical facilities, PHCs, and people not discussing about this together. So these are some of the challenges. But I think a lot is being done in this regard also because the government policies which are coming in, which are focusing on women health and women and children health and maternal health. I think even social messages are also coming these days about these aspects, about the sexual aspects. There's a lot of movies being done, a lot of documentaries being done. I think it is going through a lot of evolution, even though if it's not a revolution, it's actually evolving. And I think we are all a part of the bandwagon because if you really see, women are not taking this seriously. So when they have multiple sexual partners, unprotected sexual intercourses, they can have silent infections, right? When they have silent infections, it can affect their fallopian tubes, uterus, etc., leading to infertility at later stage.